struggle with warts on your hands or feet, these things are super stubborn, and it's a common reason that we see patients in the dermatology clinic. Let's just back up for a second and talk about what are skin warts. Skin warts are caused by a virus called human papillomavirus, or HPV. There are certain strains that cause warts on the skin. They're extremely common, and the wart virus is very contagious. Once you catch the warts, this virus goes into the deeper layers of your skin, and it starts to make your skin cells turn over fast. That leads to this bump of skin that's very thick and scaly, and sometimes even has little blood vessels that you can see inside of it that are clotted off, and that's because of the effects of the wart. Now, a common question is what to do about treating warts. We see a lot of patients in the dermatology clinic who have tried a variety of over-the-counter treatments before they see us, and we have more specialized or different treatments that we can offer. But if you're watching this video, I'm gonna go over the simple things that you can do at home before you end up in the derm clinic. So the first thing that I tell patients is warts are really a game of persistence. These things are very stubborn and you have to stick it out. I say any treatment that you try, you have to try it for at least 3 months to see if it's working. The first thing that I recommend is making sure that every night or every second night, you soak your foot or your hand or wherever the wart is in plain, soapy warm water for 5 to 10 minutes. This just softens that scaly, built-up skin on the skin surface. Then you take something like a pumice stone or a foot file and you shave down the wart. Make sure no one else in the house uses that same foot file because remember, the wart virus is contagious. After shaving it down, then I recommend using a salicylic acid-based preparation. Examples are things like Compound W, which has a variety of different strengths of salicylic acid, or something like Soluvar Plus, which is a little on the stronger side. If it's on a toe or a finger, you can actually get band-aids that are impregnated with salicylic acid, and that can also be a useful way to treat these. One of the common side effects of salicylic acid on the skin is it can cause irritation. So I often recommend to patients using a little bit of plain Vaseline petroleum jelly and just to apply that around the surrounding skin to protect the normal skin so that you are able to still use the salicylic acid on the wart. You then want to cover that area with something like duct tape or a band-aid, and usually repeat the treatments every day to every second day, depending on how you're tolerating. You need to keep doing these treatments until the wart looks like it's starting to go away, and even until it looks like the skin lines have come back in that area. If you've given it the good fight with salicylic acid and it's still not improving, you can see your doctor about liquid nitrogen or trying to freeze the wart off. Usually we do this in combination with other treatments. If that's still not working, then it's best to see your dermatologist to get specialized treatment. One thing you can do is make sure you're getting enough vitamin D in your diet and consider zinc supplementation. These two treatments are shown to have antiviral effects, and they're overall pretty safe. Best of luck with treating those warts. You can do it. You just gotta stay persistent and keep working at it.